Hello, beautiful people, and welcome to my channel. I'm super excited to have you here. Now, guys, in today's video, I want to talk about everything you need to know about Osce. I've received lots and lots of mail. Nosv, I want to come through the sponsorship route, the self sponsorship route. Can you let me know everything about Osce? Some people are like, Nosv, I want to take my Osce exam. I want to have an idea, everything you need to know about Osce. I'm going to be telling you in today's video. If this sound interesting to you, stick around. Do me a favor, like this video so you don't forget. Share this video with as many that will benefit from it, and of course, don't forget to subscribe. Without wasting any of your time at all, let's get to the details.
Ryan Little.
Alright guys, welcome back to my channel. My name is Violet Okolocha. I'm a registered nurse. I live and I practice in the United Kingdom. And guys, by the special grace of God, and it's something that makes me happy that I do, I've mentored thousands and thousands of students in passing their OSCE exam. So I'm in the very right position to tell you everything you need to know about OSCE. Now, first thing first, number one, Nurse Violet, where can I write my OSCE exam? There are 5 centers for OSCE exam. Number 1, Oxford Brooks. Number 2, Northampton. Number 3, Ireland. Number 4, Northumbria. Number 5, Leeds. Now, guys, of these 5 centers I have mentioned, there are lots of people that are rumoring, carrying rumor and saying that you pass more in Ireland than in other centers. Now, this information is not true. I want to say this to you because, like I told you, I've mentored thousands of students. I didn't say 100, I didn't say 500. I have mentored thousands of students for their OSCE exam. And I'll tell you for free, lots of people have written in Ireland and they have come to me, sent me their results and said, Nosvi, I failed in this skill. That's if I'm just showing you I failed in it by Nosvi. Can you help me? Because usually I have a passion to help everybody writing OSCE exam. Something in me. I love helping people. So, and I look at the results from Ireland, and this is a place people will tell you if you write in Ireland, you pass. No, it is the same marking criteria in all the test center. And recently somebody said to me, Nosvi, I booked my OSCE exam in Ireland and I live in London. And I said, why didn't you go to Oxford? And she said, no, Nosvi, you didn't hear. I said, Headworth. She said, everybody passes in Ireland. And I laughed and I told her, all the best. She did in Ireland and she had issues. She had to book classes with me. She did have issues. Meanwhile, lots of my students took at Oxford and they all passed in first attempts. What am I trying to say? There is no center that is bad and there is no center that is good. Book your OSCE exam closest to where you live. If you live in Ireland, book your OSCE exam close to Ireland. If you live in Northumbria, book your OSCE exam close to Northumbria. If you live in Leeds, book your OSCE exam close to Leeds. If you live in Northampton, book your OSCE exam close. So book your OSCE exam closest to where you live so that you can make life easy for yourself. It is the same marking criteria as in all the test center. Now, currently, OSCE exam costs 700 and you can see it on my screen. That's the price for the OSCE exam. Now we know the price for the OSCE exam. How for the OSCE exam you are allowed 3 attempts. So if you book your OSCE exam, for instance, in Ireland, you take it the first time and you have issues, you're allowed to take it the second time. If you take it the second time and you have issues, you're allowed to take it the third time. Now, after the third time, if you don't pass your OSCE exam, your portal is going to be closed for a period of 6 months. Do you understand? So now, in any of the 5 centers, just choose the one closest to where you live. Choose the one closest to where you live. I'll tell you for free. Just last year, some people contacted me for, Nosvi, can you help us? Can you train us for OSCE? And I said, okay, that's fine. I'm more than happy to always help out. I'm more than happy. If you know me, you know that I love to mentor students to pass their OSCE exam. or for those who have written who have issues, I'm more than happy to mentor you to pass back when you go back for your second attempt or third attempt, as the case may be. So I was more than happy to mentor them. And so when they contacted me for class, for one reason or the other, they said I shouldn't worry, they will go for their OSCE exam. And of course, they did go. They all ruled in Ireland. They all had issues. One had issues with 4 stations, the other one had issues with 1 station, blah 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 blah. And then they came back to me for help. They've all passed now, it's all been sorted. Meanwhile, I had other students who took at Oxford, they all passed in first attempt. So the main thing is the OSCE is the same marking criteria in all the 5 centers. Same marking criteria in all the 5 centers. And as long as you don't do anything to compromise a patient safety, you will pass your OSCE exam. And there's something called Viva they've introduced. Probably if you finish your OSCE exam and you forgot to mention some things, doing Viva, you are being given an attempt to say, oh, assessor, when I did nasopharyngeal suctioning, I actually forgot to verbalize that I was going to clean my patient face. So now I just remembered, in every clinical condition, when you finish suctioning, you're supposed to clean the patient face. Now, it's now up to your assessor to decide if to pass you or not. But so Viva gives you, like, after your exam, they give you like a Viva session where you air your view, anything you forgot to say or you'd have said, so that you said it in Viva does not actually guarantee a pass you get. So it's up to the assessor to decide. Now we are cleared on that. Now the OSCE exam is 10 stations. The OSCE exam is 10 station. So you can either start with a skill or you can start with a PAR. Now, NOSV, make it simpler for us. When we talk about a PAR, we talk about assessments. Now, there are 2 types of assessment in your OSCE exam. We have the community assessment and we have the hospital assessment. Now, for community assessment, there are 4 community assessments: PHQ-9, MOST, Alzheimer's disease, and of course, homelessness. And hospital assessment, there are quite a lot. We have GCS, we have all pre-op assessments. You know the pre-op assessment, right? Igonia and yang, fall and fracture, ectopic pregnancy, appendix. Also, we have post-op assessments. We have things like end of life assessment, we have dying patient assessments, we have asthma assessment, we have heart failure assessment. So there are lots and lots of assessment, but all these are in the hospital setting. Like I said, there are 2 types of assessment. So you are going to get just 1 assessment for your OSCE exam. But the thing is, you don't know which assessment you are going to get. So because you don't know which assessment you are going to get, it is important to practice all the assessments. Now you're going to get 1 assessment. When you're done with the assessments, you go to planning. When you're done with planning, you will go to implementation. When you finish your implementation, you will go to evaluation. And that's 4. We call them a PAR. Now, you are expected to do 4 skills. There are lots of skills in OSCE exam. And you are expected to know all the skills. There are lots of skills. We have removal of catheter. We have catheter sample of urine. We have administration of inhaled medication. We have peak flow meter. We have administration of suppository. We have IM injection. We have subcutaneous injection. And, so of all the skills I've mentioned, we have oxygen therapy, nasopharyngeal suctioning, NGT. We are only going to get 4 skills. But again, you don't know which skills you are going to be getting. So it is important you are aware with all the skills. Now, outside the skills I've mentioned, you are going to get 4. So we now have 8 stations. Now, there's what we call professional values and evidence-based. So professional values and evidence-based, both of them are silent station. All they will do is, for the professional value, they will give you a scenario. For instance, you are the nurse in charge of the ward and you witness a junior nurse pulling a patient off the bed. What will you do? Because as far as you know, this is an isolated incident, So you are going to answer in bullet points. Very simple. Professional values and evidence, they are very so it's a silent session. They give you a question or a scenario and you input the answer. So now we have around 15 professional values and around 17 evidence based. So 1 professional values and 1 evidence based, and that is the end of your OSCE exam. Now the question is, Ms. Violet, do you think I need training before I can pass my OSCE exam? It depends on you. You are the best person to tell yourself the truth if you need training. There are lots of people who used only my videos and they passed their OSCE exam without any class. Thousands of them. I'll post some on the screen. Just yesterday, I was going through my messages because I was free yesterday. Yesterday was a Saturday. And when I was going through my email, I was just seeing messages, over 1,000 messages of people who have said to me, Nosvi, thanks for your help, thanks for your help. I passed my skills. And then I said, okay, let me look at some. And I looked at some. Some did it without even my help, just watching my videos, and they did pass. But again, it depends on you. Nobody can tell yourself the truth like you. I always say OSCE is practice, practice, practice. When you now do watch my video on assessment and you try to do it, record yourself. If you are not getting it, then you need help. Do you understand? So it's up to you. You have to look, nobody can tell you yourself the truth like you yourself, okay? Now, if you now look at it and say, oh, I need help, I need to go for a class. A lot of people will now ask me, Nosvi, should I do online classes or should I do face-to-face classes? Which one do you think? Lots of people have sent me, Nosvi, I'm a safe sponsor. Nosvi, is it online class? Nosvi, is it face-to-face class that's better for me? Personally, it's up to you again. Like I told you, I've taught thousands of students. Last month alone, 52 of my students all did their OSCE exam and they passed, just online. It's up to you. Nobody can tell you the truth like yourself. Stuff like removal of catheter sample of urine, nasopharyngeal suction in NG tube is the same thing everywhere. Yes, it's the same thing everywhere. When you watch videos, you look at them particularly, you can do them on exam day. Yes. Lots of people have raised that concerns with me, like I love to see it face to face. I've taught students who had gone to face classes and still end up failing the skills they did face to face for. It's a professional exam, so it's not just saying it, it's constantly practicing it. Yes, there are lots of students who have done face-to-face class having to take the exam and they failed, and they have to come back to me and say, Nosvi, please, can you help me in this aspect? I took my 10 stational skill exam, I failed the 4 skills. Can you help me? I actually did my training, blah blah blah, in London. Can you help me? And if you call me to help you, it's online class I do. Do you see now? So there are still some that did face-to-face class that passed in first attempt. You understand? There are lots that did online class and passed in first attempt. What I would advise you to do is whichever you choose, just make sure you learn, you bring out your mind to learn. Honestly speaking, it's not a matter of saying the equipment. I'm telling you from experience. I did your ski exam myself. I did my own ski exam in 2020. So you see, I don't just teach ski, I've also witnessed it. And I can tell you for free, the OSCE exam is ABC. When I mean ABC, that's the simplest exam I've written in my life. You understand? So it's a very simple exam. So it's up to you. I tell you the truth. Lots of students have raised that concern. They come for online class and they pass in first attempt. It's all about mastering just knowing the right tips in the OSCE exam. Okay? Right, guys, so I don't want this video to be too long. Now the final question is, Nosvi, is it possible I pass my OSCE in first attempt? The answer is 500% over 100. Very possible. Like I told you, the OSCE exam is very simple. Very, 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 very simple. And that's why I always say my student don't fail. You understand? Because obviously it's so simple. Why should you fail if you do everything, of course, in the marking criteria? You can fail. All right, thank you so much, guys, for watching. I don't want this video to be too long. So I'll see you in another of my videos. Now do me a favor, like this video, share this video, and of course don't forget to subscribe. Have a beautiful week ahead. Bye, guys.